library. Okay, so today we are very honored to have our speakers, Dr. Azlini Ismail from Kulliyyah of Dentistry, and she will give a lecture or a sharing on plant-based remedies for hypertension. So before we start, I would like to introduce a little bit on our speakers. Dr. Azlini Ismail actually is an assistant professor from Kulliyyah of Dentistry. Currently, she is our head of research. And she actually graduated from IIUM Kuantan and followed by master and PhD from University of Science Malaysia. And she involved a lot in research related with cardiovascular and also natural product. And she also published a lot of papers, high impact factors related with this natural product and plant-based remedies for hypertension. So without further ado, I would like to invite Dr. Azlini to deliver her talk or a lecture. Dr. Azlini, the screen is yours. Thank you.
Yeah. All right. Thank you so much, Prof. Dr. Widya Lestari, for inviting me here. I think on behalf of Research Management Center and also Darul Hikmah Library. Thank you so much. Before that, I would like to share my screen. All right. So can I just have a quick check? Can you see my screen?
Yes, Dr. Azlini, very clear.
Okay. Okay, Assalamualaikum once again and good morning to everyone, and thank you for your time being here listening to this humble sharing session from me. So the title of my talk today is on the myth and basis for plant-based remedies for hypertension. So I think in Malaysia and all over the world, we have come across a lot of natural products which are claimed for hypertension. So as an academician and also community, should we believe in such claim, and is there any basis for the claim? So these are the things that I would like to cover today, and also to give an exposure to all of you, especially if you're not coming from the academic or the community. All right, so okay. Before I start on the natural product, I would like to give you a quick recap on the hypertension itself. So hypertension, as we all know, is a condition of a persistently high blood pressure, in which when our blood pressure is 140 over 90 millimeters mercury, it is considered as very high already. So what about the prevalence of hypertension? Is it common in Malaysia, and is it common worldwide? So according to the survey, it's a national survey by the Ministry of Health, 3 in 10 people or adults in Malaysia actually have hypertension. So 3 in 10 people actually is equivalent to 6.4 million people in Malaysia. So I would say that 6.4 million people is not a small number. It's a big number of people or adult population having this condition. And as we all know, hypertension, it is kind of common, yeah. So we are no longer being shocked if any of our family members got hypertension, because it becomes too common already. But is this common? Should we just ignore it, or when it is common, then we should not worry about it? The thing is that we should actually worry about it, because untreated high blood pressure can actually lead to deleterious side effects, or not side effects, but consequences, which can lead to heart attacks, which can lead to strokes and other cardiovascular diseases. And mind you that cardiovascular diseases are actually the leading cause of death in Malaysia. So we should actually worry if we get hypertension. All right. So moving on to the topic, plant as remedy for hypertension. As I mentioned before, is it just a myth, merely a myth, or is there any scientific basis for it? But before that, I would like to bring your attention to few of the so-called the traditional product in the market. This one is the one that I googled from the Shopee actually, is that an advertisement of a medication in which the claim is that few drops can actually cures everything. It's a miracle drops for the heart disease, for the diabetes, for the hypertension, for gout, and everything is actually false, can be cured actually with just a few drops. And also there were testimonies from the community in which after I use these products, I get better, my blood sugar levels goes lower, my blood pressure also goes lower, the cholesterol now becomes okay. So everything can be cured just by one product. So, and then also this is another product in which the benefit of just one squeeze, then I can sleep throughout the night happily. And also for this product, okay, the what we call the claims are so many, endless, in which it can cure diabetes, cure hypertension, can reduce cholesterol, so all these things. And then we as academician and we as a community and the public, we might wonder whether there is a demand of this product. I'm not sure about you and your family, but me and my family, we have also actually come across all these products. You can see actually from the number of the sold item is 102 already being sold for these specific products. So we believe that they are actually demand in the market for this kind of products. And this is another one, the demand of the product, 1,000 unit of these ubat mujarab, things that can cure everything, was sold in the market at a very cheap price. So we can also see from the what we got the comments below that, in which the hope of the public that this product can actually cure all their problems are actually being mentioned. So there are communities of public that actually believe in such claims. Okay, so what actually is the problem of all those advertisements? I would like to bring you to the Drug Act, in which we couldn't the sellers, the manufacturers cannot actually advertise the products to cure for these following diseases, and these also include the hypertension. This might be what we call it a common knowledge from for the academician, but for the public out there, I think it is our responsibility for the academicians to also disseminate all this kind of info to the public. Okay, and also just sharing, yeah, for the registered traditional product and also health supplement, what we should look for is the MEL number and also the hologram Meditech on the packaging. Differ from the products in which I have shown before. That one, I don't actually believe that those products are actually registered properly through the NPRA. Because why? First of all, it already contradicted with the law itself, the act in which we cannot, what we call it, the claim and everything. So in order for us to be more confident of using the traditional product and have supplement, please actually use for the MAL number and also the hologram Meditech over here. So because these registered products have actually gone through various or tedious protocols, yeah, they have to comply with many things subjected by the NPRA from the Ministry of Health. So these are just to share the different codes of the registration numbers, in which you can also you can see that T. If it ended with T, it is actually for the traditional product. So we might come across a question whether a traditional product should it be registered with the NPRA, because it is common, it is traditionally being used. So the answer is actually yes. We have actually to register the drugs with the NPRA of the Ministry of Health. All right. This is also just sharing, perhaps most of you have already known about this. In order for us, I think we have been approached by the salesman or sales girl on the product quite a few times. Then how to actually check whether the product is actually of a high standard quality or not. So we can actually go to the NPRA through this product search over here, and then we can see what we call it, whether the product is actually registered, and then what are the active constituents inside it. All right. Okay, and then also in the NPRA website also, we can also see they will actually disseminate whether the list of the products which are recalled from the market, okay, including of the cosmetics. This one we actually have heard a lot from the news, right? I mean, this cosmetic is being banned because it contained the hydroquinone and so on and so forth. So please disseminate the info that the consumers actually can check. Besides the checking of the product, you can also use the NPRA website for reporting of any adverse effects that you come across. So the danger of the products or the not quality product is that it might contain the adulterants or things that is unwanted inside the traditional product itself, in which the adverse drug reaction reports actually most of it, 78.1% actually involve the unregistered products. Okay, in which 16.7% confirmed to contain steroid. So this is actually the danger of just using the any kind of products that we encounter without checking. Okay, so from the report of the adulterated products, actually none of them registered with the KKM, and then all those adulterants are actually coming from the non-registered products. So so my point is that we can use traditional product, but ensure that we actually use the registered one. So because that one has actually complied with all the things, and the standard is actually very, very good quality. So that is just the introduction actually. So is plant-based remedy merely a myth? So having said all those things, you might get a kind of negative perception on whether the plant-based remedies, is it merely a myth? Adakah tidak berkesan langsung? Adakah is it just a false claim? So that might come across us, right? So I would like to bring your attention to the these what we call it, medications. These are very established Ayurvedic and traditional Chinese medicines. They have actually a body of knowledge, a vast body of knowledge governing the traditional medications. And also, we also have our own Malay medical manuscripts that actually talk about the same, our local plants. I am not the expert on this area, but I have come across into this one Malay medical manuscript, which is named Kitab Tip Pontianak. And in relation to hypertension, in this kitab, actually, it was mentioned 2 plants that can actually cure hypertension, in which one is setawar and also the terung pipit. If you want to see the terung pipit, this is the picture of terung pipit. The terung pipit is actually one of the common local dish, I might say, because I think my mom also cooked this one, this terung pipit. And this trompipate, okay, and then we this is actually being documented in this Malay medical manuscript. Then we wonder whether in these modern days, or in this modern era with all the scientific advances, has this claim being proven true or not? Okay, so because this one is documented for so long, but is there any current evidence that actually support this claim, right? So, okay, back to that, actually, I have done some work on this Solanum torvum itself. Actually, I've done a systematic review on this plant specifically. I've actually found that for Solanum torvum itself, it has many actually evidences coming from the modern day punya apa panggil tu experimentation that actually support this trompipate to reduce the blood pressure in various study designs. So we from that we can actually say that our own traditional plant can actually reduce the blood pressure, and it can actually be proven. All right. Okay. There are actually many, modern scientific literature in which I have come across these two papers. I believe the Frontiers in Pharmacology are two reputable, one a reputable journal, and in this review paper, it has actually compiled a lot of the medicinal plants or antihypertensive herbs. And even it has what we call it compiled the mechanism of action of these plants. Okay, in one of the paper, the first one, LDC actually have compiled many commonly used antihypertensive herbs, in which I have actually extracted a few. And if you think, or if you look carefully, that all these plants are actually very commonly being used, like the serai, right, lemongrass, and this Hylia ginger, the garlic, the celery, the coriander, right? So all these are actually the what we call it, the usual things that we use or in our dishes. Okay, and the good thing is that there are scientific evidences that support the antihypertensive claim of these plants. Yeah, so that is general. So moving on is what I'm doing now. What I'm doing now is I would like to bring you to the case study of Syzygium polyanthum. This is actually the plant of interest in which I have studied since 2010. Yeah, bringing it from just ethno-medicinal claim into developing a body of scientific evidence to support the claim. Why I said so? Because when I started in 2010, and there's a very little evidence that actually support that Syzygium polyanthum is good for hypertension. At that point of time, the plant is actually being what we call it widely known for its anti-diabetic effects. So the plant is actually very dear to my heart as the Kelantanese, because this one is, the plant is actually commonly being used in our local dishes. Kadang-kadang this one we use it as an ulam, or makan or consume it with together with budu. And then this one it is also one of the ingredient of nasi kerabu, and also you can sometimes put it inside your laksa. So it is a common punya apa panggil tu plant. In Kelantan we call it as serai kayu, but in Indonesia the plant is also very famous. They use it as a flavor enhancer in their local dishes. They call it as daun salam. So in this book by Noraida Arifin, actually it was quoted that how to use daun salam is that you have to boil it and until the what we call it, the decoction becomes concentrated, and then you consume it for the hypertension. So this is the tree of the Syzygium polyanthum, and then the leaves, dia punya flowers, the unripened and also ripened fruits. Okay, but the part which we are interested in is actually the leaves. All right. Okay, what we have done to the leaf is that we have dried it and grind it and then macerated it and then put it on the vasonicator, and at the end of the day we got this after freeze drying, and we got this freeze dried product. At the earlier days we used to just boil it, okay, but then in later part of studies we have found that the compound of interest that we want are actually more efficiently being extracted if we use the sonicator. So we have actually improvised the method of the extraction to get the best extract. All right, so from the claim, just now I mentioned about the moving on from this claim, how to develop the evidence. So, but first of all, I need to prove that the polyanthum leaves extract can actually reduce the blood pressure. So this is actually my first publication, okay, on the blood pressure reduction or blood pressure reducing effect of the leaves extract. This design of the experiment is via the intravenous route. So this is the figure actually shows on how I conducted the experiment, on how I give the extract. I have actually cannulated the right main carotid artery, and this one is actually connected to the blood pressure transducer, and this transducer actually was connected to the computer for the monitoring of the blood pressure and also the heart rate. And then we intravenously injected the plant extract into this left jugular vein. So upon the injection, we can actually immediately see whether there is changes in the blood pressure of the rats. So this is not actually the real, what we call it, figure of the experiment. But this figure here actually shows you the reduction of the blood pressure as soon as we administer the extract. This column here actually shows the aqueous extract administration, and this one shows the methanol extract administration, and these are actually different parameters. This one is the mean arterial pressure, systolic blood pressure, diastolic blood pressure, and this one is actually on the heart. All right. Okay. We actually have tested both the aqueous and also the methanol extract on both type of rats. One is the normal rats, which is WKY, or with to rats. You can see that the blood pressure is actually much lower compared to the hypertensive rats. So from this figure, actually, I have actually shown only one illustration of how it reduces the blood pressure, but actually we have tested at few other doses as well. This one only shows the highest dose, which is 100 milligram per kilogram. So as you can see from the figure, it is actually dose dependent reduction in the blood pressure, but it has become plateaued at certain point here at 40 milligram per kilogram. Then the reduction of blood pressure becomes plateaued. So meaning to say that from this experiment, we managed to show that intravenous injection of the leaf extract can actually immediately reduce the blood pressure of the rats, both the normal and also the hypertensive rats. Okay, moving on, the next study we have done is that looking at different angle, but the main intention is the same, whether it reduces blood pressure or not. But this one looking at whether it has the ability to relax the blood vessels, because we know that if we relax the blood vessel, the consequence is that there will be a decrement in the blood pressure. So this is just to show you on how the thoracic aorta that we actually use in this experiment. So from that, we actually isolate it and then clean it from all these fats, and then only we put it inside this myograph. So this myograph is actually connected to the also the tension or transducer to measure the tension of this aortic ring. So when it is in what we call it constricted, you can see that the tension is actually increased. And then when we give the what we call it the extract or also the drugs, you can see there will be a huge drop in the tension. So this actually shows that the extract can actually reduce the blood pressure, reduce the tension of the blood vessels. So it means that it causes vasorelaxation. All right. Okay. In this figure, we have shown that this one is actually for the normal rats, and this is for the hypertensive rats. So we showed that both aqueous and methanol extract managed to cause the vasorelaxation, but the effect was actually more prominent in the normal rats. All right. Besides the vasorelaxation effects, we also explore on the mechanism of the vasorelaxation, because what I like about this setting is that it is just it is very simple machine, but it can actually test it, a diverse range of the pathways for the mechanisms for the vasorelaxation. So we have actually tested quite a few of the pathways or the mechanisms. One of it is on the muscarinic acetylcholine receptors. So I'm not going into detail, but just to show you that this methanol, it involves the muscarinic acetylcholine receptor, and then aqueous, it involves the alpha adrenergic receptor. The methanol also involves the beta adrenergic receptor, and also we have managed to show that both extract also involve the nitric oxide in causing the vasorelaxation effects. So for the vasorelaxation mechanisms, there are actually many or complex or intricate pathways in which it can reduce or it can cause vasorelaxation. So what we have tested so far is this region and this region and also this region. And we are left to test on the involvement of the potassium and also calcium channels, in which I believe soon we're going to work on this area. All right. Okay. So first is intravenous route. Second is vasorelaxation, and the third one is that is via the oral route, because we have tested intravenous and then tested on the isolated blood vessels, and then people will ask whether if we give it via oral route, whether it can also reduce blood pressure. So the answer is yes. Okay, what we have done is that we have introduced the leaf extract via the gavage, and at this point of time, we are actually measuring the blood pressure of these animals without anesthesia. Okay, and this they are being put in this restrainer in order to calm them, and then we're going to measure the blood pressure using the tail cuff method over here. Okay, so for the oral route, we have two different design. One is that the acute single dose effect study, in which we actually gavage the extract just once, and then we monitor for 24 hours whether there is significant reduction in blood pressure. And then in the second phase, we have extended the duration for the administration of the extract. We repeatedly introduce the extract for a period of 3 weeks daily. So the table here actually shows the blood pressure, systolic blood pressure changes. This one at 0 before we introduce the extract, and then after 1 hour, 3 hours, 5 hours, 6 hours, and 24 hours. So what you are looking at is actually the changes of the blood pressure in the normal rats. So what we have seen is that there's not many changes. There are not many changes for normal rats, except for this one is the standard drug, which is the losartan potassium, which is it actually reduced blood pressure after 6 hours. So this one we talk about the normal rats. After that, we also tested on the hypertensive rats. We can see that the same standard drug also reduced the blood pressure after 6 hours. But interestingly, we found that our extract, it started to reduce the blood pressure from 1 hour after the administration. All right, and then you can see after 3 hours, after 5 hours, and after 6 hours, you can see there's still a persistently decrease in the blood pressure of the rats. Yeah, but then after 24 hours, everything returned back to the normal, same like the standard drugs. Okay, from that phase of study, we then proceed with the repeated dose. So we just choose one specific dose at 2.5 over here. And then we introduce the rats. This one we are just testing on the hypertensive rats. All right, so what we have seen here is that a reduction in the blood pressure of the hypertensive rats beginning from week 2 until, and it is persistent until the week 3. Also, when we tested, the systolic blood pressure is also reduced. Okay, and this is the effect of our extract for Aqueous, and also this one is for the methanol extract. We can see that for the methanol extract, the extract actually reduced blood pressure starting from 2nd week. But for Aqueous extract, the decrement is there in the 2nd week, but the significant decrement is actually happening at the 3rd week. All right. Okay. That is actually everything for my PhD. And then this one is actually when I actually reported duty at IIUM. Actually, I was given the RIGS, IIUM RIGS crimes. I managed to continue this study. So this one, the intention of this study is that I would like to see what are the possible compound that is actually responsible for the antihypertensive effect of the Syzygium polyanthum. So I have my student here, Alina Norasmira. The background is chemistry, so that's why we come up with this, what we call it, fractionation. And we managed to get 3 fraction actually from this plant, from the Aqueous extract. Okay, and then we compare the 3 fractions with the original Aqueous extract. How is the efficacy of all these fractions? So what we found that is the 2nd fraction, or F2A-SP, actually give a better reduction of blood pressure compared to the Aqueous, is the red one. So we can see across all the parameters, the 2nd fraction actually give the more efficacy, and also the ED50 also is better compared to the Aqueous extract fraction. But and also we have profile the chemical compounds inside the what we call it, the original Aqueous extract, and also the 3 fractions, and we found out that each and every of these fraction together with the original Aqueous extract, they contain the 1 galol glucose. All right. So, okay, moving on. This one is, I started this project for the FRGS. So this one is looking at different angle for the antihypertensive. This one is an in vitro assay looking at the ability of the plant extract to inhibit this enzyme. So just a quick review of this enzyme. Actually, this enzyme will convert the angiotensin 1 into angiotensin 2, in which this angiotensin 2 is a potent vasoconstrictor. So if there is an increased number of angiotensin 2, then we will get an increment of blood pressure. So by targeting this enzyme, or by inhibiting this enzyme, we can actually reduce the blood pressure. So we have actually drugs, commercial drugs, that actually specifically working on inhibiting this ACE. All right. So we actually have compared the ACE inhibition activity of few types of extract, the aqueous extract, methanol extract, ethyl acetate, and also hexane extract. And again, we actually get the highest activity for the aqueous extract. So that's why we just proceed with the aqueous extract at this point of time. And then for this aqueous extract, we have further tested at a few concentration until we get the IC50 value of 41 microgram per mil for its ACE inhibition activity. And then we also have tested on the mechanism on how it actually inhibits the ACE. So we have found out this one quite recently. We have found out that the involvement of the protein precipitation of aqueous extract, that is how it inhibits the ACE, and also it was non-dependent to the zinc at the ACE active site. So that is our recent findings, but this is more towards the specific mechanism on how it works. Okay, and quite recently as well, I've actually collaborated with Kulliyyah of Science with Associate Professor Dr. Azmir, and so I've got one student here, Tuan Ashraf Faiz, working on this one. We are interested to see our compound of interest just now. If you still remember that we kind of target this 1-galal glucose, and we try to do the molecular docking of this 1-galal glucose with the enzyme at the ACE, and then we compare with the ACE inhibitor drug, which is captopril. And quite interestingly, that we found a better interaction of this 1-galal glucose with ACE as compared to the captopril. So I think that's all. Actually summarizes all the research findings regarding the system polyanthum. So in summary, I would say the plant-based remedies is not merely a myth. Okay, it has potential to be developed further into quality herbal medicine. So there are, even though the pathway is very long, the journey is hard, but I think it is a must for us to heighten the standard of our own local medicinal plant. These are us. This is my Sifu, my mentor, Dr. Wan Amir, and Shahida. We actually was featured in Berita Harian before, and many acknowledgement of the grants over here from the USM, my PhD research, and also continuation at IIUM here, and a few my supervisors, my mentors, the late Prof. Said Mohsin, in which I was in his supervision only for 1.5 years, and then he passed away. But he was actually the one that initiated this project to me, and then I was under the supervision of Dr. Wan Amir, which is actually the supervision never ends because we are still collaborating until now. And then Associate Professor Dr. Mahanim and Prof. Siti Amrah Sulaiman from USM, and here I've really indebted to the Professor Muhammad Noor Omar and my recent collaborators, Dr. Izzat, Dr. Azmir, and also Dr. Besma, and my students. Shahida now is Dr. Shahida, recently graduated PhD, and Erlina, and also Tuan Faiz. I think that's all from me. Yeah, potential next project is that I would like to open for collaboration for isolation of bioactive compound and also for product development. I think that's all from me. Thank you so much for your time.
Okay, thank you so much, Dr. Azlini. Very interesting. I think that very useful knowledge for us. So we open for Q&A. Any question from the members? You may directly ask to Dr. Azlini. Yes, we do have one, Dr. Azlini, from the chat box. What the software do you use for the graph?
Okay, for the graph, actually, we are using the GraphPad Prism software. That one I was introduced to it during my years in USM by Dr. Wan Amir Nizam. It's a very good software actually. I really prefer the GraphPad Prism compared to the SPSS. Yeah, so it's GraphPad Prism. It's very convenient, easy to use. you might consider to use it. Yeah.
All right. Thank you. Any more questions? Okay, Dr. Azlini, I have one question. It's just a very simple question and quick one. In the future, you plan to come up with some product, right? So
yes.
Any more? I mean, like how you would like, the design and everything. So can you tell us the brief about the products?
Okay. I think I've actually do some sort of research, market research. I think the plant itself, it's being marketed in Indonesia actually widely for the form as drink. They make it as what we call it, the uncang one, and then they just like a normal tea, and they use it for what we call it, antihypertensive remedy. But I don't actually see the product yet in Malaysia. But normally I was thinking of developing some sort of pills or tablets. I think that would be suitable for our local punya market lah. But yeah, I'm not the what we call the expert on the formulation of the product. So that's why I actually welcome everyone if there is potential collaboration on that area. I gladly welcome to involve to collaborate.
Yes, I think we have one from Dr. Naim here. One question. Let me. You want to read it by yourself, Dr. Azlini, in the chat box?
Is there any clinical data on this plant to support potential antihypertensive properties, or is it still not tested clinically? All right. Okay. As you can see from my study, all the studies have been done in vitro and also in vivo, but in vivo in animals, especially in the rats. But I have come across recently a paper from Indonesia in which they have done, or they have tested on patient itself. And I think they have what we call it, found interesting evidence on the efficacy of this plant to reduce the blood pressure among patients in Indonesia.
All right. Any more questions from the members? Dr. Besma, maybe?
Assalamualaikum.
Yeah, please, doctor.
Yeah, it's very interesting. Actually, the work is very good from the beginning, and I totally agree with Dr. Azlini, because many of the natural products now in the market without any approval, this need to be highlighted. This need to be not randomly sold, because there are a lot of side effects which may we may get from these if they are not approved. So the approval and the registration is very important, and this take, as Dr. Azlini mentioned, very long time, but we need to go through it. The preclinical studies, the clinical studies, all of these we need to go through, and we need to also advise the people not to use it randomly. We need to advise more about these things because many problems happened when it's randomly sold. This is one of the field, and we are working hard for the products under UIA. Inshallah, we will achieve it, and it will be one of the approved and registered ones. Inshallah, we can achieve the goal. Thank you, Dr. Azlini, for the nice presentation. Thank you so much.
Thank you, Dr. Besma. Thank you, Dr. Besma, and for information for the members. Dr. Besma is also working on the natural product, so we actually welcome you guys for a collaboration, with Dr. Besma as well. All right. So, any more questions from the members? I think it's enough. If no more question, I think that thank you very much, Dr. Azlini, for the very nice presentation and also the knowledge, yeah, for all of us here. And this actually also stream into this YouTube, so that I think that everyone can watch the YouTube later on, so that hopefully the community as well can gain some benefit from that. So thank you very much, everyone. I close this session with Tasbih Surah Kifayah and Surah An-Nas.
All right, thank you, everyone.